Personally, there have been times where I've felt pressure to share my medication. I've definitely been asked, I still am asked, like pretty frequently, and that's sort of changed my feelings about sharing, even that I have an ADHD diagnosis, because I know that the follow-up question typically is, well, like, what do you take for it?
Premiumbeat.com.
I definitely think it's a lot more prevalent than a lot of college campuses admit.
I think the way that college is structured a lot of the time can definitely lead to a huge level of stress.
This expectation for the students to take all this extra workload and just make it work.
There's a lot of pressure to perform from, a lot of different places. Financially, either you or your parents are putting a ton of money into it. You're putting a ton of time into it. Getting a college degree is pretty much the requisite for going on and having a career. So there's a lot on the line, and I think people feel compelled to pretty much do whatever it takes to succeed. I definitely don't think that everyone is misusing stimulant medication, but I do think that the idea that everybody is misusing it is very prevalent on college campuses. If somebody's asking me for it and I'm uncomfortable, I say that makes me uncomfortable, and like, this is why, and you should also know that, you don't want to be the Debbie Downer, and it's hard to like take that responsibility on yourself.
I definitely feel like students on college campuses feel pressured to share their medication, especially as this idea of it being a smart or study drug spread around.
Students probably have a lot of reasons for misusing stimulants. I think there's an assumption that it's going to make you perform well, it's going to make you want to study, you're going to do better with the stimulant. Colleges just aren't doing enough in terms of awareness in regards to stimulant misuse and the potential consequences of it.
I do not think students understand the potential risks of using this without a prescription.
Relying on stimulant medication when you're not consulting your doctor it's pretty dangerous. If you're relying on stimulant medication to motivate you, you're not developing coping skills that you could be developing if you weren't relying on a substance to motivate you.
People view it as a study aid, more like a cup of coffee than a real drug.
I think changing perceptions about misuse is probably relying on getting the information about the consequences out. Peer communication would be really effective, would probably be the most effective means of educating and having a conversation about stimulant misuse.
What I strongly feel students, even my peer group, really responds to is honesty and being upfront.